toll-like receptor 4 use this pathway, and the Rig-like receptors also use this. What these do when they get stimulated is to also activate a set of transcription factors to go into the nucleus. And these are very important for activating the type 1 interferon genes. There are two forms of these, an alpha and a beta. And so when something gets sensed here, some viral nucleic acid, double-stranded RNA, the cell knows it's virally infected, and it turns on the interferon gene. Okay, so what does the interferon do? So we have a virus here. The virus is going to make its mischief. It's going to cause a problem. It needs to get in, and it needs to be transcribed, make messenger RNA. It's going to get translated into protein to make more virus, and we now make more pathogen. So if type 1 interferon gets produced, and it binds a type 1 interferon receptor, this activates a number of mechanisms that will both block transcription of the viral mRNA, block protein synthesis of the virus, and it can interfere with the viral assembly. And so what this pathway is doing is that when you sense viral infection, it's attempting to stop or slow down the viral factory, which is a good thing from the host perspective. So the innate receptors stimulate rapid defense through the production of mediators. Toll-like receptors and some nod-like receptors stimulate many inflammatory mediators and molecules via NF-kappa B. Rig-like receptors and some toll-like receptors also stimulate type 1 interferon production. And these receptors also stimulate some other pathways that we don't have time to cover. Okay. So in the last bit here, we've been talking thus far really about what happens at a local site of a problem. An infection, some bacteria gets in the skin, it gets in the liver, and the innate immune system is mobilized to deal with that. It's all very local, right at the site of infection. But it turns out that you can also, as you are, I'm sure, well aware, can get systemic effects of inflammation. And I'm just going to cover this very briefly. So, many of you, unfortunately, have had influenza infections, the flu. What are the symptoms?
Cough.
Cough.
Sneezing.
Fever. Okay, how do you feel? Terrible, right? Move them out. And are you hungry? Painful? Lose your appetite. So you get fever, you feel lousy, malaise, you lose your appetite, anorexia. And relevance to many of you here where your interests are, in malaria, one of the important presenting symptoms are very high fevers, right? So it turns out these are all systemic manifestations of inflammation. So what happens at a site of infection where we're getting inflammation, these mediators are getting made, the cytokines. And they're driving all of these processes like we've just talked about. But if you make enough of these cytokines, they'll actually get absorbed into the blood, they'll begin to circulate. And the important ones here are three: interleukin 1, interleukin 6, and TNF-alpha. So here we have an infection, the leukocytes engage, they make the cytokines, these get into the bloodstream. And one of the places that they go is in the brain. And in the brain, what these cytokines will do is they'll act in the hypothalamus, which is where the thermostat is for your body. Okay? And it's going to tell about it, and these cytokines will cause cells to produce prostaglandins. And these will reset the thermostat. The body thinks it's too cold. And so it's going to try to warm it up. And so this will activate the vasomotor centers to cause your sympathetic nerves to activate, which will cause the blood vessels to vasoconstrict in the skin. So now we retain less heat out there. We retain heat and we develop fever. In addition, these cytokines cause the brain to make you feel lousy, feel terrible, and also to lose your appetite. What do we tend to treat ourselves with?
Aspirin.
So you go to pharmacia, aspirin, non-steroidal anti-inflammatories. Those are blocking the prostaglandin synthesis, which, as you know, improves the symptoms. Now, however, if the cytokines levels get high enough, the body gets in trouble because you vasodilate all over, you drop your blood pressure, you can go into shock. And I'm not sure, but I think some of the subsequent speakers might speak about your systemic and inflammatory effects, which can be shock and death. Okay. So what we've tried to cover is a fairly broad subject. We've done it, I've tried to give you an overview. We've talked about how you get the infection, how this is actually sensed, how the body then mobilizes its defenses, what are the different kinds of these defenses, and what they do. So I said, actually, I'm finishing on time. So I want to leave you with a little video that will impress you, if you're not already impressed, that although the innate immune system is quite old, it evolved a long, long time ago. You should have respect for ancient things because they can be very powerful. So that sounds. Don't cut me. Unfortunately, our taxes aren't working for them. We can deal with our budget. Alliance.